We've heard reports that the vaccine rollout is going slower than expected across the country. Well, today, Monroe County Public Health Commissioner Dr. Michael Mendoza is saying our area has not escaped this disappointing start. Kayla Green joining us live from outside of our studio. Kayla, what's the latest on the vaccine rollout here in our area?
Adam, while leaders say that we have ramped up the number of vaccines we're giving per week since we started this whole process, they say we're still going to need more vaccine to get everyone in the region vaccinated by the end of the year. Dr. Mendoza says he hopes to speed things up and have the majority of people vaccinated by the fall. We're currently in phase 1A of the vaccination process, which includes healthcare workers and people in long-term care facilities. Dr. Nancy Bennett from the Finger Lakes Vaccine Hub says it's unclear when we'll move on to phase 1B, which includes essential workers and people aged 75 and older.
We still have a lot of healthcare workers to vaccinate. So 1A is actually a pretty big group of people across the region. Between long-term care facilities and healthcare workers, it amounts to about 100,000 people. It will be weeks before we move to 1B. It could be 2 weeks, it could be 6 weeks.
The hospital systems have given roughly 20,000 vaccines, and the Monroe County Health Department has given 1,200. Many have also been given in long-term care facilities, but these are given through a federal partnership, and leaders say we don't have that number. Dr. Mendoza says the process is moving along slower than he'd like, but it's helping them work out the kinks.
The myriad of logistics is mind-boggling, from scheduling, from staffing, from all of the traffic-related concerns, getting all of the people to a particular site. With these vaccines, you have to wait 15 minutes. So you can't have too many people coming to get their vaccine all at once because you may have to violate social distancing to have them wait in the same space.
Dr. Bennett says by the end of this week, the hospital systems could use up their current vaccine supplies. She and Dr. Mendoza say their goal is to have the majority vaccinated by the fall, but we need more supply.
We do not have sufficient vaccine yet to vaccinate our entire population, and we are dependent on other vaccines being approved for use and being deployed in the vaccine campaign.
At the current rate, no, we're not going to be able to finish by the end of the calendar year, and I don't think that anybody wants to be doing this next year.
They say people over the age of 75 in phase 1B will be contacted by a hospital system or their primary care doctor when it's time to get the vaccine. They say essential workers will likely be contacted by their employer. For anyone else wondering where you fall in the vaccine process, you can check the New York State website. Live in Rochester.